Good morning, I'm Adam Sexton. New Hampshire's battle against the COVID-19 pandemic is approaching the one-year mark. As vaccination efforts continue to grow, a key aspect of getting shots in arms is a renewed focus on bringing the vaccine to traditionally underserved populations. It's something the state is calling its equity response, and here this morning to discuss that effort is Bobby Bagley, Director of Public Health and Community Services in Nashua, and Dr. Beth Daly, Chief of the Bureau of Infectious Disease Control at DHHS. Thank you both for joining us. We know you're among the busiest people in the state during this pandemic. We do appreciate the time, but let's start with you, Bobby. One of the biggest issues facing the equity response in the vaccine is convincing people that getting the shot is safe, because over time in the U.S., trust with certain populations has been a hurdle when it comes to public health. So how do you break down that wall?
Good morning and thank you. That's a very good question. One of the major things that we do is we make sure that we acknowledge that those things in our history, they existed, and we educate individuals on the fact that this vaccine is safe, that scientists have been doing research on SARS for at least over a decade, and the benefit of getting this vaccination is going to save lives. And so we need to acknowledge our history and at the same time address the fact that this is very important for us to save lives and end this pandemic. And so we provide people with information about the vaccine, the safety of it, the efficacy of it, the studies that were done, and the importance of getting vaccinated right now.
Dr. Daly, from a statewide perspective, how do you identify where to target the equity response?
Sure. Good morning, everyone. So we have this commitment to make sure that there's equitable access to vaccine within our phased allocation strategy. The way that we're identifying vulnerable populations is using the COVID-19 Community Vulnerability Index that looks at about 40 different variables from income, education, underlying health conditions within a population, the demographics of that population, to target actual census tracts across the state that have more vulnerable populations. And then from there, we work with our regional public health networks who will go into those communities, identify community partners who can engage those different vulnerable populations and establish those vaccination clinics to help get those people access to vaccine.
Ms. Bagley, you only have a finite amount of resources. There are two huge pieces of this, the outreach and the getting shots in arms. How do you balance that with the resources you have, doing that outreach and then trying to get those shots to the people?
We've been able to balance that by hiring community health workers that are from the populations and that identify with the targeted populations that we are working with. And so when we're able to build that trust in the community and we push out information that is factual and true, we are able to connect with individuals in their primary languages. And we've had very targeted approaches through our faith-based community, through our partnering organizations that serve population groups that may have been disproportionately impacted by COVID. And then what we have had is a great turnout and response initially to getting vaccinated. And so our clinics right now have been thriving.
And that factual information in this day and age, obviously huge in building trust as well. Dr. Daly, when the mobile response teams are heading out into a place with the vaccine to try and do battle with the virus, essentially, it's a ballpark number in terms of what you're going to be able to deliver on shots. So how do you judge when an effort on a daily basis has been a success when it comes to equity?
Right now, we are allocating 10% of the vaccine that's coming into the state each week to this initiative. And so what we are looking for is to establish as many clinics as possible to use up all of that vaccine each week. Obviously, it's taken a little bit of time to ramp up the program as the public health networks go ahead and look at the data in their communities and identify those partners. To date, we've had 61 different events scheduled, and we're hoping to reach about 6,000 people through this upcoming week. But we want to increase those numbers of events going forward. And at this point, we just want to use as much of that vaccine as possible. And that's our current kind of measure of success. Going forward, though, we're certainly going to look at the populations that we're reaching in more detail.
Ms. Bagley, we know Nashua is one of the most diverse places in New Hampshire. I'm just curious, how many language barriers have you had to break down in order to get that information to every different population in the Gate City?
So our major populations speak Spanish, Portuguese, and we have several different African dialects. And so we have community health workers that can speak Portuguese, Spanish, and several of the African dialects as their primary languages. We've printed our information and had it translated into 6 different languages thus far. So we have a flyer that has been disseminated into the communities and again, the primary languages that are spoken. It's really important to connect with the community. And so our community health workers actually call and speak to folks just in case the literacy level is not as high as it can be. And to date, we've vaccinated over 1,072 individuals through the various clinics that we've had. Today, we're expecting to have over 300 attend our clinic that's scheduled for today.
And Dr. Daly, we know that a lot of families in these situations live in multi-generational homes. I'm just curious for your perspective on the epidemiology side. That can be a real builder of the virus, unfortunately, right? When you have so many people of different generations in one household.
Absolutely. So we know that being a household contact to an individual with COVID-19 is a major risk factor. In fact, this is where, much of the transmission that has occurred on an individual basis is happening in our state. And when you have a multi-generational household, you have people who maybe are younger, still in the workforce or going to school, who might be going out into the community and having that opportunity for exposure. And then they bring it back home and can potentially spread it to their family members who are at increased risk, such as grandparents or older parents, people who are going to have more serious infections. So we're absolutely concerned about those multi-generational housing units and making sure that we get vaccine to them as well.
I want to ask both of you about an issue that's parallel to this, but part of it as well, and that's the homeless population. Dr. Daly, do we have a ballpark or an idea yet on how much of the homeless population in New Hampshire has been reached or even contacted through the equity efforts?
Mm-hmm. So a number of our regional public health networks are going out to the community, identifying soup kitchens and shelters that serve people experiencing homelessness, and they are establishing clinics in those areas. I know that we've done or plan to do 8 clinics through this week at those types of locations. And of course, want to get as many people vaccinated as possible in this very vulnerable population.
How about in Nashua, Ms. Bagley? When it comes to reaching the homeless, what have been some of the successes and some of the things that obviously you would like to see improve?
One of the things that we did was we partnered with our Nashua Soup Kitchen and Shelter. And that was, in fact, one of our first clinics that we had during the point in time count in January. And we did just finish their second dose vaccination clinic yesterday. And so we just continue to provide the outreach. Our plan is to be there at least once a month to offer vaccine to individuals that frequent the warming station there. And we're also partnering with our other organizations that provide services throughout the homeless population. And we make sure that they get to that particular clinic.
We know the numbers on the pandemic are on a positive trend at the moment, and there's so much hope, I think, for the spring and the summer. But when it comes to the COVID-19 equity response, where would you like to see these efforts when we get into March, April, May, and perhaps June, July, and beyond? Starting with you, Dr. Daly.
Sure. Well, basically, we just want to make more of these events happen, increase the allocation that we're providing to the program, and getting more people vaccinated. So we'll continue to expand the different groups that we're able to reach. Right now we're focusing on our phase 1B populations, making sure that we're getting into low-income senior housing. That's where the majority of our events to date have been held statewide. And then we want to expand beyond that, like we're starting to do with the homeless shelters, as well as soup kitchens, other types of vulnerable populations, engaging with faith-based organizations and other community partners. So basically, expansion of the program is what I'd like to see.
I'm guessing it's similar there in Nashua, but Ms. Bagley, what's your perspective on where you want to be come the middle of the summer?
So I would do exactly what Dr. Daly just said, that we do continue to plan with the outreach into the National Housing Authority units here, our senior housing units, as well as maintaining every week the community clinics for the equity allocation, and then continuing to work with our partnering organizations and getting their clients vaccinated. And so we have a long haul. We have a great team on board with lots of support from the state. So we'll continue those efforts.
And wrapping things up with you, Ms. Bagley here, I'm just curious, the entire effort of public health in a way is about equity. So in some ways, none of that has changed, but there's this awareness now that we've undergone in the country, an awakening around the situations facing people, Black, Indigenous, people of color. So what are your thoughts on how this is going, in particular with the awareness of what needs to happen for these populations, not just within your work, but in our society as a whole?
So the thing that, COVID has hit our country, and particularly our state really, really hard. this opportunity to respond in an equitable approach across the board is something that we have to continue to do. And so we've identified some best practices. We want to make sure that we continue to collect the data that allows for us to see where the gaps are, and then make sure the resources are there to continue to support any effort that's regarding public health, emergent responses, chronic diseases. We want to continue all of these efforts that we've begun with the COVID, and making sure that we just maximize that across all of the public health issues that we have to face, whether it's housing, transportation, economic, gaps, educational gaps. We just need to make sure that we address all of those determinants of health that impact all of our population, so that everyone has equitable access to every opportunity to live as healthy as they can.
All right, Bobby Bagley and Dr. Beth Daly, thank you both for your efforts and for being here on Close Up today. We appreciate it.
Thank you.
Thank you.